Thanks for joining us for another one of our video broadcasts. Joe DiMatteo, here to try to help you deal with a very common problem today, neuropathy, peripheral neuropathy. Not going to cover the whole gamut of neuropathy because there could be neuropathies that are as a result of everything from shingles, post-herpetic neuralgias, and so on. I want to focus a little more on peripheral neuropathy, fingertips, hands, feet, legs, lower limbs, as to really the focus. Peripheral neuropathy. First of all, be seen medically. Make sure you get checked. Gosh, there could be some disease that's, God forbid, there could be tumors, there could be things. So you always want to make sure that you are seen medically to rule out any of those areas. Beyond that, you've gone to neurologists, you've gone to neurosurgeons, and they tell you, well, we can't find anything wrong. You might have some compression of a disc, which we'll cover. I think your options are whatever. Gabapentin, a medication. Lyrica. All right, there's limitations. We have more limitations, or we have more options for you in that regard in our compounding lab to put some of those medications into topical forms that could help you with neuropathies and peripheral neuropathies that are much more, I believe, effective with less side effects, central nervous system side effects, sedation, neurologic issues, especially when we start talking about meds like Lyrica, pregabalin, gabapentin, even some other meds that are technically antidepressant medications that affect dopamine and norepinephrine, I believe, or dopamine and serotonin pathways, drugs such as Cymbalta. We'd rather see you do something topically if we have to go pharmacologically. But back to the basics, which is my whole message. How do we get here? How do we get to a component of peripheral neuropathy? Quite frankly, it's off the charts. What is it? Well, numbness, tingling, burning, pain, bizarre sensations to the extremity, pins and needles. I don't want to say everybody, but most folks have different descriptions for how they feel. Those are some of them. Some are flat out pain. Some I feel like my feet are on fire. Feel like I can't feel my feet. There's numbness. I have tingling. I have shooting sensations. The whole gamut of issues. Peripheral neuropathy. Potential causes. Diabetes, obviously the number one. I don't want to go into a lot of detail. This will be an hour-long video. I don't want to do that. We're just going to say the core, diabetes. Spinal stenosis is a potential issue where there's closure of the outlet of the nerves that transpose through the spinal column, and the inflammation is beginning to compress those nerves. Spinal stenosis. You should see a neurosurgeon to make sure. Lumbar issues, lower lumbar issues, where there's maybe some disc damage or degenerative joint disease, degenerative disc disease, or maybe you have a slightly bulging disc, or there's some damage to that disc where it is compressing the outlet of the nerve that is exiting the spinal column. That should be visited also by a neurosurgeon to make sure. Alcohol, excessive alcohol consumption at a core because not only because alcohol damages tissue in a very generic term, excessive, but depletion of certain nutrients, in particular the B vitamins, as being an issue here. There can be autoimmune. Now, many of these, autoimmune, another subject, alcohol, you've got to stop. If you've got lumbar or spinal stenosis, you need to see a neurosurgeon. If you have diabetes, you must manage your blood sugars clearly without question. Otherwise, what you get is what we call a glycation process. Elevated sugars beginning to cross-link with proteins, virtually causing cement between your cells. Toxin exposures, chemicals, environmental chemicals, big issue here. I believe this is one of the keys right here. I believe some compression of the disc is another one. Certainly diabetes, but again, that one's pretty obvious and how we had that one off. I want to focus a little bit more on the ones that are lower level that are not seen as we deal with peripheral neuropathy. Gluten intolerances, big issue here. Big issue. Mitochondrial damage to the extremities. Johns Hopkins back in 2011 released a paper, some studies they did in an abstract form, basically saying this, that the farther you are away from the exiting point for your spinal column, when they tested the nerves in the buttocks area and then the length of your limb, your leg, down to your toes, down to your heels, down to your instep, that those nerve components showed much more mitochondrial damage. What are mitochondria? You have tons of mitochondria within each cell. They generate energy. Toxins, chemicals can damage those mitochondria. And what they're saying is, we have to get nutrients because you have tubulin structures that run through those nerve tissues that carry, like little tunnels, that carry nutrients and oxygen and so on. Also chemicals and metals. So their theory is, the taller you are, the longer your legs, the older you are, a lot of factors. But those, my words here now, folks that have been exposed to a lot of issues, toxins that they're not clearing, what happens is the nutrient exposure to the extremities is much harder, basically, to get it there. So healthier nerves, diminishing in health as you go down in distance from the spinal column. So neuropathy often, I think this is a big issue. These two right here, toxin exposure, chemicals, gluten intolerances, mitochondrial damage. And unfortunately, the world of pharmacology doesn't deal with that, doesn't deal with toxin exposures, chemicals, metals, and doesn't deal with mitochondrial damage. Poor vascularization is another component. Poor vascularization, just saying, for many of us, we have poor blood flow, especially in diabetics, which encourages this process. So what are our options here? Remember, this is a quick educational piece. I can't go into all the detail, but you have to eliminate these, be seen medically, rule out some of these areas. So let's talk about changes that you can make. Number one, if you're overweight, you must lose weight. That's critical. Number two, if you don't exercise, you must exercise. There is absolutely strong support for weight loss, exercise, movement. Why? Because you reduce inflammatory proteins, cytokines, chemokines. See, because your fat cells, your fat tissue, becomes an exocrine gland. Endocrine meaning my thyroid, my pancreas, and so on, that produces components that affect other organs and tissue. Exocrine meaning it's not part of a God-given endocrine component, but it secretes hormones that can elicit and create damage at other endpoints, distant points, that ought not to be in play. Lose weight, must lose weight. Physical activity, exercise, must stretch, must encourage blood flow to those extremities, have to move. Get an inversion table if you're able physically. Get on the inversion tables, elongate the spinal column, decompress the spinal nerves, stretch, walk, run if you can, bike, swim. And I'm just saying, I'm giving you this information because it does work and it does help. I would consider going gluten-free if you really have some major issues. Decreasing inflammation for some of you is critical. A lot of options there. That's a little bit of a sidebar. The basics are stretch, exercise, lose weight, and now back to the beginning. You've got to get onto a whole foods diet. You must reduce the amount of processed and refined foods in your diet. And we must, this is key, generically speaking, this is why we often need to work with you individually. So this is kind of a cover for where maybe we need to work individually. So because you got to rule out, well, is it diabetes? Is it spinal stenosis? Is it some lumbar compression because of degenerative joint and disc disease? But if you kind of rule those things out and you suffer from peripheral neuropathy, pain, tingling, numbness to the extremities, now I've got to energize the mitochondria. Critical. It's critical. I've got to get blood flow, vascularization or revascularization. I've got to eliminate some toxins, chemicals, pesticides. You know that most pesticides, and technically herbicides, pesticides in particular, are neurotoxic to the bugs that they kill. They're lipid-loving, they're fat-soluble, they're nerve-loving. Where do you think they end up in your body? In this stuff here, in these little paunches, our adipose tissue, and in your nerve tissue. Have a high affinity for neurologic tissue. And we are exposed to tons of them. Why you need to eat organic or preferably locally grown vegetables. You've got to be aware that the chemicals and toxins that you are exposed to just from your food supply end up in nerve tissue, which can be a big player. That's why I believe peripheral neuropathy is off of the charts. Thank God for Johns Hopkins that said, look, farther away you go, something's happening down there, the tissue's being damaged. Bottom line, nutrient-wise, this is an awesome product. Neurophex DPN has specific nutrients that are shown to be supportive in individuals with peripheral neuropathy. Number 2, I'd recommend Cellular Essentials. Why? Because this is not just a multi, it's a kind of a quasi-multi with specific nutrients that raise detoxification in a simple manner at a cellular level and really raises mitochondria cellular energy, Cellular Essentials. Next layer that I would think about is coenzyme Q10. Why? Mitochondria. You got to raise mitochondrial energy because of mitochondrial damage. A lot of ways you can do that. Can't think of one singular nutrient that does it better than good absorbable forms of CoQ10. If it is because of diabetes, blood sugar issues, even if you're not a diabetic, you'd be a pre-diabetic, you still could be prone to this, I would use Alamax CR. It's a form of alpha-lipoic acid in an extended release form. I would encourage. So this kind of begins to work what your specific situation and condition is. Acetyl L-carnitine, if there's damage, or if there's compression, or if there's spinal stenosis. Even if you have spinal stenosis or you have lower back issues, you still must stretch. You've got to see a physical therapist, chiropractor. You've got to work with these men and women. They can help you lose weight, strengthen your core, decompress the spinal column. Big, big help. But the 3 basics, Neurophex DPN, good forms of coenzyme Q10, Cellular Essentials. This is a very key way, along with lifestyle modification. Is this a cure? I don't know if it's a cure. The folks that we've worked with have had significant improvement. And anybody that has suffered from peripheral neuropathy is just looking, in many cases, for some level of improvement. That's vital. Medications, you want to rethink. Maybe medications topically that we compound in the lab, that's a better option because you have less central nervous system, you have less systemic side effects. And then the lifestyle and specific nutrients, you might want to call and set up a time with us to work and to help you try to figure out where your specifics are. But get a B12 level, get a 25-OHD level as well. Thanks for joining us. God bless you. See you on the next video broadcast.